We're going to begin this hour with troubling signs that the Omicron variant may hit the U.S. harder than many of us had hoped. The number of reported daily cases topped 800,000 on one day last week. Yikes. Now, that does not include those who tested positive with the at-home test or have mild symptoms and never got tested at all. So this is leading some experts to tell the federal government that we need a new strategy to fight this pandemic. One of those experts is epidemiologist Dr. Celine Gounder. We love when she's here. She joins us at the table. Good to see you, Dr. Gounder, because you and two other very prominent doctors, Zeke Emanuel and Michael Osterholm, have sent a letter in JAMA, and you're saying, listen, we need to have a new normal. A new normal with COVID-19 does not include the eradication or elimination. We've got to figure out a way to live with this. So what exactly do you mean? Because the Biden administration is saying, listen, we're going to beat this. We will beat this. I think we're all waiting for that ta-da moment. It's over. That's not happening, you say.
Gayle, I think we would all love to jump in a time machine that would take us back to November 2019. I think for some people, that means I just want to forget about COVID. I want to go about my normal life. For some people, it means let's eradicate or eliminate COVID so we don't have to worry about it anymore. And unfortunately, if your goal is to save lives, to prevent hospitalizations, we're going to have another strategy. We can't go back in a time machine, but we can take action.
So where do you put what number of daily cases or daily hospitalizations or daily deaths are we then comfortable with as a country to move into this new normal and say, okay, it's behind us mostly. The emergency's over.
Yeah.
Tony, what we're using as a starting point for discussion, and people might disagree and think about, that's too strict or that's not strict enough, but what we're using as a starting point for discussion is what did really bad years of flu and RSV and other viral respiratory disease look like pre-pandemic, and using that sort of as a benchmark for starting the conversation. I think some places will want to really suppress cases even more than that, but some places might want to be more liberal, but that's a starting place.
Yeah, some people say just stop being afraid and just go back to work. And you're saying that's not at all what you mean.
Yeah, I think...
Because I'm so tired of being tired and being afraid of this. I am trying to navigate myself. What can we do? What should we not do?
Right. And I think the expression learn to live with COVID can be problematic because I think it's really about saying to people, stop being scared, get back to work.
That's not what you mean.
Yeah, what we're saying is we're going to have to coexist with COVID. And how do we do that safely, where people are not ending up in the hospital, where our hospital system is not buckling under the weight of all of those COVID cases as it is now?
Can you help us understand what's going on with kids right now? Because we keep hearing about a big increase in the number of kids hospitalized and the total percentage of kids hospitalized. But at the same time, we're hearing that if you dig into the numbers, some of those kids are coming in with a broken hand, but they also test positive. So they're not there for COVID.
Right.
So when we're kind of figuring out risk and how bad things are, how do we deal with that?
So we're seeing so much COVID in the community. Everybody who comes in the hospital gets tested because we need to sort out who needs to be in a COVID room versus a regular room. So everybody's getting a test. And just because there's so much of it out there in the community, you're going to have some people who come in, a kid with a broken arm who just happens to have COVID. And it is a challenge right now. I've just been on service at Bellevue the last 2 weeks. Some of our patients, maybe I have a patient who came in with heart failure, COVID tipped them over the edge, but they don't really have a bad case of COVID. Do you say that's with or from? There's this whole gray zone in between.
So it makes it hard to know how worried you should be then when you hear these numbers.
It is. And this is something that, epidemiologists, statisticians are really trying to dig into to figure out how much of this is truly Omicron causing bad lung disease versus you just happen to have it.
Dr. Gounder, so we got vaccinated, boosted so we can have optimal protection, right? And I want to speak from the perspective of some friends and family, maybe even some viewers that are sitting at home saying, okay, well, I know people that are vaccinated. I know people that are boosted, that are still getting COVID. So why should I go out there and get vaccinated and boosted? Because we still have a large population of individuals that are hesitant. What would you say to them?
That's right. We have over a third of Americans who are still not vaccinated. And that is a real challenge to getting back to a more close to semblance of normal. What I would say is that, yes, we are seeing breakthrough infections even in people who are boosted, but they're like the common cold. They're not landing you in the hospital. These are not people we're having to put on a ventilator.
It's less severe.
Much less severe.
You protect yourself.
That definition of mild, though, does seem to be a slippery slope because I've heard some people who you guys say are mild, they're not in the hospital, but they're really, really in a lot of trouble and it's very painful for them.
The way we as doctors define what is mild versus severe is really a question of, do you need oxygen? Do we need to put you on supplemental oxygen? Have your oxygen levels dropped without it? That's how we define it. So you might feel awful, but you're not requiring that extra oxygen.
So when you say we need to learn to live with it, I'm still trying to figure out exactly what we have to do. Should we go? Is it okay to go to a restaurant? Is it okay to go to a play? Is it okay to go to a sporting event? Is it okay to travel? What does that mean?
So the key interventions that we outline in the JAMA pieces are, in addition to vaccination, masking, so really upping your mask game to either a KN95 or an N95 mask, improving indoor ventilation and air filtration, and then using testing to figure out who's contagious, who's not, who needs treatment. So, for example, you mentioned the Broadway Theater. That's a place where you can wear a mask, where they can improve their indoor air ventilation, air filtration, and they do ask you at the door, are you vaccinated?
Yeah, they do.
So there's layers of protection there.
You're okay with the at-home test? Because there was some question about that. Are you okay with at-home test?
So there was, in fact, two colleagues of mine, one who works with the sports leagues, Robbie Sika, and Blythe Adamson, who works with the Broadway theaters, collaborated on a study looking at this. And what we're seeing is that the rapid tests do work. They pick up Omicron probably about 2 days later than a PCR test would. If you're testing every day, you see that. But they do work.
All right, Dr. Celine Gounder, I know this won't be your last time at the table, but so glad you're
appreciate you
here.
coming by.
So glad you're here today. If you have any questions about the coronavirus pandemic, share them with us, and our medical team will try to answer them for you. And you can send your questions to our CBS Mornings Facebook, Twitter, and Instagram pages, or you can email us too. Lots of ways to get in touch. Coronavirus@viacomcbs.com.